Today I'm going to talk about public policy and COVID in nursing homes, and hopefully over the next few slides try to shed some light as to why things may have unfolded the way they did in our nursing facilities. So to do that, we'll first discuss a couple of the federal regulations that were in place for infection prevention and control policies and programs in nursing homes up until COVID. Then take a look at, what do nursing homes need to report or what healthcare associated infections do nursing homes have to report and how do they do that? And then we'll specifically talk about reporting of COVID in nursing homes. So actually, over the past several years, there has been a lot more attention to infection prevention and control in nursing homes. And you can see here that in 2016, there were several changes to the requirements for participation in CMS for nursing homes. And many of those changes actually targeted infection prevention and control policies. So by the end of November 2016, nursing homes were required to have an infection prevention and control program in place. The end of 2017, an antibiotic stewardship program. And then by just this last November 2019, facilities were required to have somebody work as their infection preventionist or IP. Now, back in July of 2019, there were a lot of concerns that the new reform regulations were too burdensome for nursing homes. So there was a lot of pullback on some of those regulations. And one of them was actually related to that requirement to have an infection preventionist or IP. And you can see here that there was a proposal to remove that requirement for the IP to work in the facility part-time or even have frequent contact with the infection prevention and control program. Now, I will say, even before this came out, many facilities, including our facility, weren't necessarily hiring infection preventionists. They were training staff they already had. So those assistant directors of nursing or directors of nursing, would do the training and then kind of wear that hat as the infection preventionist. And then COVID came along. And so not surprisingly, the first positive case of COVID in the United States was a nursing home resident. And not surprisingly, the first outbreak of COVID-19 was in a nursing home. This is the MMWR report from King County, Washington, the sort of first facility to report this outbreak. You can see here it's quite devastating. 81 residents were positive and 23 persons died. And as we just heard, many other facilities and many states sort of have followed this similar pattern. There were a lot of good take-home points from this MMWR. A couple of them included, first, just the limitations in effective infection prevention and control in nursing homes, despite those policies that had been enacted. Additionally, they really highlighted the role of healthcare workers in both the intra and inter-facility spread. So those healthcare workers that are caregivers, frontline workers that have very close contact to the residents, so picking them up, moving them to the bathroom, and who often work in multiple facilities. So they'll have part-time jobs, they'll work in one facility on Monday, another facility on Tuesday. And many of these sort of frontline, high-touch healthcare workers, sorry, I don't know why I keep switching, do not necessarily have the luxury of calling out sick. So they made a few highlights related to healthcare worker policies in this report. So a lot of people ask, why don't we know more about COVID in nursing homes, and why did it take so long for nursing homes to report COVID? So I want to talk a little bit about what facilities were required to report with respect to healthcare associated infections. So folks who work in the hospital are probably familiar with the National Healthcare Safety Network. And within the patient safety component, hospitals use this for infection reporting and are mandated to report certain infections. What's probably less known is that there is actually reporting for long-term care facilities. So there's a long-term care facility component, which long-term care facilities can use for infection reporting. It's been around a while. It's actually developed in 2012. It's not as robust as the patient safety component. However, there's never been a federal mandate for nursing homes at the federal level to report healthcare associated infections. And so only about 3,500 or so out of the over 16,000 nursing homes actually report into NHSM. And certainly, this sort of, healthcare associated infections and even COVID reporting has been really variable in long-term care facilities by state. Certain states like Pennsylvania has a very robust HAI reporting, and Nevada, I think, requires facilities to report into NHSN. So just a lot of variability. And we heard earlier from Dr. Lindquist and Dr. O'Brien about, the reporting in Illinois, and I just put up New York as well. And just over the past couple days, they have now mandated, requiring COVID positive patients and deaths, and have required increased transparency. So if you go on their state website, you can look and see how many facilities and what county and how many deaths each nursing home had. So a lot of variability, and it really wasn't until last week that I think that there was a lot more transparency across multiple states. So until now, so just this past Sunday, CMS reported that nursing homes are going to be mandated to report COVID-19. So here's the press release. Again, it just came out last Sunday. And basically what they said is that CMS will now require facilities to report data directly to the CDC, for both residents and staff. And there will be enforcement, and they also include transparency. So really, this is we're the first time that there's ever been really a federal mandate for any HAI reporting in nursing homes. I just wanted to talk briefly about assisted living facilities. Dr. Lindquist talked earlier about this, but just to kind of highlight the differences. So again, assisted living facilities are actually state regulated, and there's a lot of variations in regulations by the state. One important point that I think we learned just with Dr. O'Brien as well was that many residents in assisted livings actually have more personal caregivers. So there's more of that interaction of the healthcare worker going into the facility. And I just put up these different news articles on this slide because when you sort of search COVID and nursing homes, if you read actually the finer print, a lot of them are talking about assisted living facilities. And again, I think it's just an important point to make when you're looking, trying not to lump all nursing homes together, but understanding the differences and the different regulations that each are required to have. Okay, so where does this take us? Well, I think it certainly has brought to the forefront just this need that, despite sort of these regulations being in place, and I should mention that the Kirkland, Washington nursing home was a 5-star nursing home, that, we really do need to figure out how to better, or focus on infection prevention and control infrastructure and policies in nursing homes. And I think one thing we haven't, maybe in the past have not paid as much attention to is those sick policies for those frontline, high direct care healthcare workers, and then also PPE. But I want to say that, I think the experience at the Clare has really shown that with the right, support from the medical director, the right support from the administration, and the right guidance, that facilities actually can do this. I think the other big component or lessons learned is that, we need to think about how we're, reporting healthcare associated infections in nursing homes. And do we really need to push for more systematic reporting? I like this graph just because I think it shows, I think we tend to think of nursing homes as, we're caring for older adults who, may need assistance with ADLs, but we're doing much more than that, especially in skilled nursing facilities. So we're managing catheters, we're managing PICC lines, we're managing G-tubes, we're managing trachs. There are several facilities in Illinois that manage chronic ventilator care and complex wounds. So we're really taking that group of patients that were in the hospital who have all of these, more support for, IP programs and are reporting healthcare associated infections, putting them in a different location, and then, removing a lot of that infrastructure. Then, I think as evidenced by the fact that we're here talking today at Grand Rounds, just that increased communication between nursing homes and health systems, and how we really can, at a health system level, think about infection prevention and control without thinking about nursing homes. And that's, I think, true beyond COVID. So I like this picture. It's older. It's from 2011 from Orange County, and you can see on the top where sort of interfacility discharges for nursing homes. In the middle was acute care facilities, and then on the bottom is sort of them mixed. And really, just kind of what this shows is just how nursing homes connect many hospitals that would otherwise not be directly connected to each other. So again, just highlighting what just the important component nursing homes play when we think about communicable diseases. And then finally, again, just mention the assisted living facilities and how those play a role. And that's it. Thank you.